I think the important thing we have to realize is that we have to look at things long term. The Ebola outbreak at this point is the main focus, where obviously with the prevalence and the rate of infection between those who are sick to then transmit to those who are not has been significant and exponential. But we have to approach it from a multi-pronged approach. And so the area that I think Samaritan's Purse can do well in is the fact that we have an established national staff of over 300 people that have already been in the field, working in the communities and providing education over the last 10 to 12 years. And they're already there in place. And with this Ebola outbreak, these same individuals are still on the ground, still working. And what we have to do is implement a strategy where we can equip and increase the capacity to allow the communities and people in their homes to care for their own sick ones. So what we want to do is to train the nationals to be equipped, to be provided with the knowledge and education, increase their resilience, their capacity to actually then care for those victims, because Ebola will be extended. And even when we contain and overcome this particular outbreak, the data from previous outbreaks is that the Ebola will stay and recur over time and at various points in the future. So we want to establish and develop resiliency. We want the communities to increase in their capabilities. We want them to be able to then care for their own people. And that is not in contradiction or in contrast or against the efforts that are already being done, because that is an addition, is a more comprehensive method. And Samaritan's Purse is not only just doing that, but there's also the community care centers that is being done. So therefore, I think as an organization, we cover a wider spectrum from the treatment capabilities all the way to the home capabilities, especially in areas where the remoteness makes it very difficult for healthcare givers or doctors and nurses to go to because they're so remote. So when we educate these remote communities and provide them to be resilient, that I think is a very important thing to do.